Have you ever felt that quiet moment of worry when you hear about a rare illness and wonder what it could mean for someone your age? One of my patients once shared with me that what frightened her most was not the diagnosis itself, but the feeling of not understanding what was happening inside her own body. I want you to imagine this for a moment, sitting comfortably at home, listening to information that is meant to steady you, not rush you, and not alarm you. My name is Dr. Evelyn Carter, and I have spent many years caring for older adults and walking alongside families through moments of uncertainty. Today, we are going to talk gently about Nipah virus and how, in rare cases, it can lead to sudden coma. I want to say this clearly from the beginning. Nipah virus is uncommon, and learning about it does not mean danger is close. Understanding is an act of care, not a reason for fear. As we age, the brain becomes more sensitive to stress, infection, and sudden changes. This is not a weakness. It is part of how a lifetime of experience shapes the nervous system. When an infection reaches the brain, the body sometimes responds by slowing everything down. Loss of consciousness or coma does not happen out of nowhere. It is usually the result of a chain of biological reactions meant to protect the brain when it feels overwhelmed. In my clinical experience, I have seen that panic and rushing often cause more harm than the illness itself. The brain processes information best when a person feels safe, respected, and unhurried. Simple neuroscience supports this. Emotional calm allows the brain to think more clearly, even when facing serious topics. Here on Senior Health Daily, my goal is to help you understand your health without pressure. If this conversation feels helpful to you, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily so we can continue this journey together. In the next part, I will explain in clear and simple terms how certain viruses affect the brain and why older adults deserve information that protects both their health and their dignity. Nipah virus is a name that many people have never heard until it appears in a headline or a quiet conversation with a doctor. It is a virus that exists in certain parts of the world and appears only rarely, especially when compared to the infections we see every year. Because it is uncommon, it often feels unfamiliar, and unfamiliar things tend to feel more unsettling, particularly for older adults who have lived long enough to know how precious clear thinking and steady awareness truly are. Over the years, I have noticed that when a health topic involves the brain, it carries a special weight. The brain holds memory, personality, routine, and independence. For seniors, it also represents dignity and identity. When people hear that a virus can affect the brain, their minds often jump ahead to the worst possibilities. That reaction is very human, but it is not always helpful. Rare does not mean mysterious, and rare does not mean inevitable. It simply means we do not encounter it often, which makes calm explanation even more important. Nipah virus belongs to a group of viruses that can, in certain circumstances, affect the nervous system. Scientists have studied it carefully over the years, not because it is common, but because understanding rare illnesses helps medicine prepare and protect. In clinical practice, knowledge is like a quiet light. It does not rush you forward. It allows you to see clearly where you are standing. Older adults often feel more concerned when learning about brain-related illnesses because they may already be managing memory changes, slower thinking, or conditions like mild cognitive impairment or dementia. From a caregiving perspective, this concern deserves respect. The aging brain works harder to process stress, and sudden alarming information can feel overwhelming. That is why learning must be gentle and paced. From a biological standpoint, the brain becomes more sensitive with age because blood flow, immune response, and repair mechanisms change over time. This does not mean the brain is fragile. It means it responds differently. Understanding that difference helps us replace fear with patience. It also helps families communicate more calmly when questions arise. In my years caring for seniors, I have seen how reassurance grounded in facts can restore emotional balance. When people understand that a virus like Nipah is rare and monitored closely by medical systems, their breathing slows and their thoughts settle. Understanding is not about preparing for disaster, it is about protecting peace of mind. This conversation exists because clarity matters. Even rare conditions deserve clear explanation, especially when they involve the brain and the lives seniors have built with care and intention. When we talk about how a virus can enter the body and reach the nervous system, it helps to slow the conversation down and picture the body as it truly is. The human body is not careless or unprotected. It has many layers of defense that work quietly every day, often without us noticing. Most viruses never make it past these defenses, and that is especially important to remember as we talk about something as rare as Nipah virus. A virus typically enters the body through natural pathways such as the nose, mouth, or lungs. From there, the immune system usually recognizes the intruder quickly and responds. In many people, especially those with stable routines and good general health, the process ends there. The virus is contained and cleared without ever reaching deeper systems. This is how the body is designed to function. The brain, however, has an extra level of protection called the blood-brain barrier. I often describe it to patients as a carefully guarded gate. Its role is to allow helpful nutrients and oxygen to pass through while keeping harmful substances out. This barrier is one of the most important reasons the brain can remain stable even when the rest of the body is fighting an infection. As we grow older, this barrier can become a little less selective. This does not mean it fails, it means it adapts. Changes in blood vessels, inflammation, and immune signaling can make the barrier slightly more permeable. In simple terms, it may respond more slowly or less tightly than it did in younger years. This is a normal part of aging and something we see across many neurological conditions, not just rare infections. In my clinical experience, this is where understanding brings comfort. When a virus does reach the nervous system, it is not because the body gave up. It is because the system responded differently under stress. The brain may react by altering consciousness, not as a collapse, but as a protective response to inflammation or swelling. This is the body trying to preserve function, not lose it. Science supports this perspective. Studies in neuroscience show that aging brains prioritize energy conservation and protection when faced with threat. That is why symptoms like confusion or deep sleep can appear before more serious signs. These changes are signals, not sudden endings. For older adults and caregivers, the most important takeaway is this: the body has wisdom, even in illness. Understanding how viruses interact with the nervous system helps remove the mystery and replaces it with patience. When information is delivered calmly, the brain itself feels safer. And when the brain feels safe, it copes better with everything else that follows. When Nipah virus affects the brain, it does so in a way that is better understood through function rather than damage. I often remind patients that the brain is not a fragile object waiting to break. It is a living, responsive system that adjusts when something disrupts its normal rhythm. What we call encephalitis simply means inflammation in the brain, and inflammation is the body's way of signaling that something needs attention and care. Inflammation does not arrive all at once. It develops gradually as immune cells respond to signals they believe indicate danger. In the brain, this response can interfere with communication between nerve cells. Messages that once traveled smoothly may slow down or become less clear. Thinking may feel foggy, attention may drift, sleep patterns may change. These are functional interruptions, not signs that the brain is failing. In older adults, these changes can feel especially unsettling because routine and familiarity matter so much. I have seen patients who suddenly feel less steady, simply because their brain is working harder to maintain balance and clarity during inflammation. This effort can show up as confusion or withdrawal, much like what caregivers sometimes observe during infections such as pneumonia or urinary tract infections in seniors. The pattern is familiar even when the cause is rare. From a scientific standpoint, the brain responds to inflammation by conserving energy. It reduces unnecessary activity so that healing process can take priority. This is why rest becomes so important. It is also why changes in awareness can occur without pain or dramatic symptoms. The brain is protecting itself by slowing things down. In my years of caring for older adults, I have learned that naming this process gently helps reduce fear. When people understand that the brain is responding rather than deteriorating, their anxiety softens. Caregivers feel more confident. Patients feel less threatened by what they are experiencing. Emotional safety matters deeply during moments like these because stress itself can worsen cognitive symptoms. Simple neuroscience supports this approach. The brain functions best when it feels supported, not pressured. Calm environments, consistent routines, and reassuring communication help stabilize neural activity during illness. This is especially true for seniors who may already be managing memory changes or sensory overload. What matters most is remembering that encephalitis is not a sudden collapse of who someone is. It is a temporary disruption in how the brain communicates and regulates awareness. With understanding, patience, and appropriate medical care, the brain often regains its balance. Respecting this process allows dignity to remain at the center of care, which is where it belongs. When changes in consciousness appear, many people immediately imagine something final or irreversible. In my experience, this reaction comes from not knowing how protective the brain truly is. The brain is not designed to push itself until it breaks. It is designed to preserve itself, even if that means stepping back from full awareness for a period of time. Loss of consciousness or coma does not usually happen without reason. It is often the brain's way of managing overload. When inflammation, infection, or chemical imbalance interferes with normal signaling, the brain may reduce incoming information to protect its core functions. I often explain this as the brain dimming the lights so it can repair the wiring without distraction. In older adults, this response can occur more readily because the brain has spent decades adapting to stress, illness, and change. With age, the nervous system becomes more sensitive to disruption, not weaker, but more responsive. When the brain senses that its environment has become unstable, it may choose rest over activity. This can appear as deep unresponsiveness, but inside, important processes are still at work. From a caregiving perspective, this understanding matters deeply. I have sat with families who feared they were losing someone forever, when in reality, the brain was doing exactly what it was meant to do. It was protecting itself from further harm. Coma, in this context, is not a collapse of identity. It is a temporary state of conservation. Science supports this explanation in simple ways. Brain imaging and metabolic studies show that during states of reduced consciousness, the brain lowers its energy use and focuses on essential regulation. This shift allows inflammatory signals to settle and circulation to stabilize. It is a strategic response, not an accident. Emotional safety plays a powerful role here. The brain is influenced by its surroundings, even when awareness seems limited. Calm voices, familiar routines, and gentle presence can support recovery. For seniors, this is especially important because the emotional memory system remains active even when conscious thought is reduced. I often remind caregivers that patience is part of treatment. The brain heals in its own time. Pressuring for immediate response can create stress rather than progress. Understanding coma as a protective pause rather than a meaningless shutdown allows dignity to remain intact. When we view altered consciousness through this lens, fear gives way to respect. The brain is not abandoning the person. It is guarding them, quietly and purposefully, until balance can return. One of the most important parts of caring for an older adult is noticing small changes early, long before anything feels urgent. In my years of working with seniors and their families, I have learned that the body often whispers before it speaks loudly. Those whispers are not meant to alarm us. They are meant to guide us. Early changes in brain function can look very ordinary at first. A person may seem more confused than usual, especially in the evening. They may need more time to answer a simple question or appear less interested in conversation. Some begin sleeping longer during the day or seem unusually tired after routines that were once easy. These shifts are subtle, and because they develop gradually, families sometimes wonder if they are simply part of aging. This is where experience with dementia care becomes helpful. Many caregivers already recognize similar patterns in conditions like Alzheimer's disease or other forms of cognitive decline. Slower responses, difficulty focusing, or increased need for rest are familiar signs. When a viral infection affects the brain, the changes can resemble what families have already seen before. That familiarity can be grounding rather than frightening. Infections often place extra demand on the brain. When the brain is working harder to manage inflammation or chemical imbalance, it may temporarily reduce its engagement with the outside world. This can show up as withdrawal or quietness rather than distress. From a neurological perspective, the brain is prioritizing internal regulation. It is choosing stability over stimulation. In my clinical experience, families who understand this respond with more patience and less panic. They slow their speech. They simplify routines. They offer reassurance rather than repeated questioning. These adjustments matter. The aging brain responds best to calm consistency, not pressure. Scientific research supports what caregivers observe every day. The brain's ability to process information depends heavily on energy balance. When illness disrupts that balance, cognitive speed and alertness may decrease. This is not a loss of intelligence or personality. It is a temporary shift in function. For seniors who already live with memory challenges, these early signs can feel familiar and therefore easier to recognize. That familiarity is a strength. It allows caregivers to trust their instincts and seek guidance early without fear. What matters most is maintaining dignity. Confusion and fatigue do not define a person's worth or future. They are signals that the brain needs care and rest. When families respond with understanding and gentleness, they create an environment where healing is more likely. Noticing early signs is not about anticipating the worst. It is about staying connected, attentive, and respectful. These small moments of awareness are part of good caregiving, and they often make the greatest difference. As we move through this conversation together, I want to pause for a moment and speak to you not just as a physician, but as someone who has spent many years listening to older adults share their worries, their hopes, and their quiet questions about health. One thing I have learned is that healing is never only medical. It is also emotional and deeply human. Many seniors tell me that what they miss most in today's health information is a sense of connection. Appointments feel rushed, explanations feel technical, voices feel distant. That is why spaces like this matter. When we take time to talk slowly and honestly, the body responds differently. The nervous system settles. The mind feels less alone. Even complex topics become easier to hold. I have seen remarkable changes when people feel supported rather than overwhelmed. A patient who felt frightened after reading alarming headlines became calmer simply by understanding what was happening and why. A caregiver who felt uncertain gained confidence by learning that confusion and fatigue can be signals, not endings. These moments remind me that knowledge, when shared gently, restores dignity. This community is built on that belief. Senior Health Daily exists to offer a steady place to return to, a place where questions are welcomed, a place where aging is treated with respect, a place where the brain and the heart are cared for together. Whether you are watching for yourself or for someone you love, you belong here. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. When people connect through shared understanding, something meaningful happens. Fear softens, confidence grows, care becomes more thoughtful. This is especially important when we talk about brain health, memory changes, or rare illnesses. No one should feel isolated while trying to make sense of their body. As we continue, remember that you do not need to absorb everything at once. Learning can be gentle. You can pause. You can reflect. You can return when you are ready. Health information should meet you where you are, not pull you somewhere else. Thank you for being part of this community. Your presence here matters more than you may realize. As we continue, it is important to talk gently and honestly about why older adults can be more vulnerable when an infection affects the brain. This is not about weakness, and it is not a failure of the body. It is about how a lifetime of living, adapting, and caring shapes the nervous system over time. From a simple physiological perspective, the aging body works differently than it did decades ago. Blood flow to the brain may be a little slower. The immune system may respond with less precision, sometimes creating more inflammation than is needed. The brain itself uses energy more carefully, choosing what to focus on and what to let rest. These changes are part of normal aging, not signs of decline. When an infection reaches the brain, even a rare one, it creates extra demands. The brain must manage inflammation, regulate temperature, balance chemicals, and maintain awareness all at the same time. In younger bodies, these systems often adjust quickly. In older adults, the same adjustment may take longer. The brain may protect itself by reducing alertness or slowing responses. This is not because it cannot cope, but because it is choosing stability over speed. In my long years of caregiving, I have seen this pattern repeatedly. Seniors who develop infections often show changes in thinking or awareness before any other symptoms appear. Families sometimes worry that dementia has suddenly worsened or that something permanent has happened. In many cases, what they are seeing is the brain reacting to stress. When the stress resolves, clarity often returns. There is also the reality that many older adults live with underlying conditions. High blood pressure, diabetes, heart disease, or existing memory challenges can all affect how the brain responds to illness. These conditions do not cause infection, but they can influence recovery. This is why personalized care and close observation matter so much in later life. Science supports what caregivers observe every day. Research shows that aging brains are more sensitive to inflammation and changes in oxygen or glucose levels. This sensitivity does not mean fragility. It means responsiveness. The brain is paying close attention to its internal environment and adjusting behavior to protect itself. What I want older adults and caregivers to hear clearly is this: increased risk does not mean inevitable harm. It means the body needs more patience, more rest, and more understanding. When caregivers respond calmly and routines are maintained, the brain feels safer. That sense of safety supports healing in ways medicine alone cannot. Respecting the aging brain means honoring its pace. It has carried memories, skills, and relationships for many decades. When it asks for extra care during illness, it is not failing. It is doing what it has always done, protecting the person it belongs to. One way I often help families understand brain-related infections is by comparing them to situations they may already recognize. When something feels familiar, it becomes less frightening and much easier to manage with confidence. Many caregivers have seen how a simple urinary tract infection can cause sudden confusion in an older adult. That experience can teach us a great deal about how the brain responds to stress. A urinary tract infection does not begin in the brain, yet it can still affect thinking, attention, and behavior. A person who was steady the day before may become forgetful, restless, or unusually quiet. This happens because infection anywhere in the body sends signals that disrupt the brain's normal balance. The brain senses inflammation and chemical changes and responds by adjusting awareness. It is not broken. It is reacting. When a virus affects the brain directly, the principle is similar, even though the location is different. In both cases, the brain is responding to stress by changing how it processes information. Confusion, sleepiness, or slower responses are ways the brain protects itself while the body works to restore balance. Understanding this parallel helps remove the sense of mystery that often surrounds rare neurological infections. In my caregiving experience, families who have already navigated infection-related confusion often feel more grounded when facing something new. They recognize the signs. They remember that clarity returned once the infection was treated. This memory brings reassurance. It reminds them that altered thinking does not always mean permanent change. Science explains this in simple terms. Infections trigger inflammatory chemicals that circulate through the body. These chemicals can affect brain signaling, especially in older adults whose systems are more sensitive. Whether the source is the bladder or the nervous system, the brain reacts to the same signals. It reduces cognitive effort and focuses on regulation and recovery. What matters most is how caregivers respond. Just as with urinary tract infections, gentle communication, familiar routines, and a calm environment make a difference. Speaking slowly, offering reassurance, and avoiding overstimulation help the brain regain stability. These strategies are not just comforting, they are supportive of healing. I often tell families that the brain remembers safety even when memory feels fragile. Tone of voice, presence, and patience are powerful tools. When caregivers remain steady, the brain has less reason to stay on alert. By comparing brain infections to more familiar conditions, we shift the focus from fear to understanding. The message becomes clear: the brain is responding, not failing. And with time, care, and appropriate medical support, it often finds its way back to balance. As we talk about protecting the brain in later life, I want to bring the focus back to the quiet foundations of health. In my experience, the most powerful protections for the aging brain are not dramatic interventions or constant worry about rare illnesses. They are the steady routines that support the body every single day. Routine gives the brain a sense of safety. Waking, eating, moving, and resting at familiar times helps regulate hormones, blood flow, and sleep cycles. For older adults, especially those living with memory changes, routine reduces the amount of energy the brain must spend on decision-making. That saved energy can then be used for healing, thinking, and emotional balance. I have seen patients become more alert and calmer simply by restoring a consistent daily rhythm. Rest is equally important. The brain repairs itself during sleep. Inflammation settles. Memories are processed. When illness or stress disrupts sleep, the brain becomes less resilient. Encouraging regular rest, short naps when needed, and a peaceful sleep environment is not indulgent. It is therapeutic. Seniors often feel pressured to stay active even when tired, but listening to the body is part of respecting it. Nutrition plays a quiet but essential role. The brain relies on steady glucose, healthy fats, and adequate hydration to function well. Poor appetite during illness can quickly affect cognition. Simple meals, gentle encouragement to drink fluids, and patience with changing tastes support brain stability. This is not about perfect diets. It is about consistency and care. Medical follow-up is another cornerstone. Regular check-ins allow small changes to be noticed early. Adjusting medications, monitoring blood pressure, or addressing infections promptly can prevent unnecessary strain on the brain. In long-term care settings, I have seen how consistent monitoring reduces confusion episodes simply by keeping the body in balance. What I want to emphasize most is perspective. Rare conditions like Nipah virus capture attention because they sound alarming, but everyday care is what truly protects the brain. Routine, rest, nutrition, and attentive medical oversight build resilience over time. They support the brain whether a person is healthy, recovering, or living with chronic conditions. For caregivers, focusing on these foundations restores a sense of control. You cannot prevent every illness, but you can create an environment where the brain feels supported. That environment matters more than fear. When we shift attention from rare possibilities to daily care, dignity is preserved. The brain is given what it needs to function at its best for as long as possible. This approach honors aging not as a problem to solve, but as a stage of life worthy of patience and respect. As we come to the heart of this discussion, I want to leave you with a message that has guided my work for many years. Medical knowledge is not meant to place older adults on constant alert. It is meant to give them and their families a shared language, so that when questions arise, conversations with doctors can be clearer, calmer, and more productive. I have often seen seniors arrive at appointments feeling unsure of what to say. They sense that something has changed, but they worry about sounding dramatic or confused. Families, on the other hand, may feel overwhelmed by medical terms or afraid of asking the wrong question. This is where understanding becomes a bridge rather than a burden. When you know that confusion, fatigue, or changes in awareness can have many causes, including infections and inflammation, you are better prepared to describe what you see. You can speak about patterns instead of isolated moments. You can say when something began, how it differs from usual behavior, and what seems to help or worsen it. These details are invaluable to clinicians, especially when caring for older adults whose symptoms may be subtle. From my clinical experience, the most effective medical visits happen when patients and families feel empowered rather than intimidated. Knowledge allows you to participate in decisions without feeling rushed or dismissed. It also reduces fear, because uncertainty often creates more anxiety than the condition itself. Simple science supports this approach. Clear communication improves diagnosis and treatment outcomes. When doctors understand the full picture of a senior's daily life, routines, and changes, they can tailor care more accurately. This is particularly important for brain health, where emotional state and environment influence symptoms as much as biology does. I want to emphasize that being informed does not mean expecting the worst. It means knowing what questions to ask if something feels off. It means recognizing when a change may be temporary and when it deserves attention. Most importantly, it means preserving dignity by treating older adults as active participants in their own care. In long-term caregiving, I have learned that respect and patience are as healing as medicine. When seniors feel heard, their stress decreases. When families feel informed, their confidence grows. This creates a calmer atmosphere for everyone involved. So let this knowledge serve you gently. Hold it as a tool, not a warning. Use it to communicate clearly, to advocate thoughtfully, and to remain grounded. Health information should support connection, not fear. When it does, it becomes one of the most powerful forms of care we can offer. As we come to the end of our time together, I want to slow everything down and simply thank you for staying with me until now. Listening with care is already enough. You do not need to remember every detail or hold every explanation in your mind. Understanding even a small part is an act of respect toward your body and your life. The aging brain asks for patience, not pressure. It asks to be treated with dignity, not urgency. Learning about Nipah virus and sudden coma is not meant to place worry on your shoulders. It is meant to remind you that medicine continues to move toward protection, clarity, and compassion, especially for older adults. Knowledge should soften the nervous system, not tighten it. Over many years of caregiving, I have learned that the body carries deep wisdom. Even when it slows down, even when it asks for rest, it is still working to preserve what matters most. Gratitude for the body does not mean ignoring illness. It means trusting that care, time, and understanding are powerful partners in healing. Senior Health Daily exists for moments like this. When health information feels loud or overwhelming, this is a quiet place to return to. Here, we take our time. We explain gently. We honor the experiences that come with age. Above all, we protect dignity. If this conversation brought you a sense of calm or clarity, I hope you will stay connected with us. Follow Senior Health Daily so we can continue walking this path together, one thoughtful conversation at a time. Thank you for your trust, your patience, and your presence. Take a slow breath. Your body has been listening too.